Hello, everyone. This is Chadi Alraies from RSH 2026. Privileged again to be with Dr. Ahmad Thabet to talk about management of valve and valve for patient with failed bioprosthetic valve. Ahmed, thanks for being with us.
So, Dr. Khaled, thanks for the invitation and thanks for being here in Riyadh. I would like to say about the TAV in TAV or
Yeah.
the TAVR in surgical bioprosthesis. And I think we have the theme and the dilemma of the durability of the bioprosthesis generally. And we used to put the younger patients always for the surgical bioprosthesis because we know the durability data about them. Nowadays, we have some data about also the TAVR prosthesis, and we have the partner 3 trial, which also showed the 7-year outcome from the bioprosthesis from the TAVI, which is non-inferior to the surgical prosthesis.
Yeah.
So we get with the indications lower and lower in age and low risk patients, and um, we will face the problem or this dilemma and scenario of TAV and TAV more and more in the next coming years. Of course, it is challenging depending on the index prosthesis. So if we have the high frame prosthesis, the self-expanding, we have the most challenging scenario with the neo skirt and the coronary obstruction risk.
Right.
And sometimes we have to go for the electrosurgical solutions to split the leaflets and make a way for the coronary perfusion. Um, and
Is
the
the
key,
planning of the procedure usually helpful by having like a 3D printing or just CT is enough?
yeah. Well, I think CT is the hand and foot, but of course we have some modern technologies where we can really make a 3D simulation of the second procedure with the second TAVI valve in the index TAVI prosthesis to get more real vision into the coming risk and to make an exact planning. Um, I think, to my knowledge, there was one 3D program, and now we have at least a
Yeah.
second one.
What is the most common, like if you list in bullets, the most common complication of valve and valve?
Um, Coronary obstruction, I would say. This is the most dangerous complication, it also depends on the native anatomy. So, if we have a bicuspid valve in the index procedure, and we have a TAVI or a surgical biprosthesis implanted in this bicuspid anatomy, so of course we have some different challenges because the prostheses are commonly underexpanded, and then sometimes we need to give some more aggressive overexpansion of the prosthesis, and this makes annular rupture. But I think with careful planning, the annular rupture is really not that common, but the coronary obstruction is the biggest challenge.
Yeah.
Yeah,
Well, Ahmed, thank you so much for a very insightful presentation and summary of
thanks.
valve and valve management and
Yeah,
planning. Watch these videos and others on the YouTube channel. This is Chadi Alraies coming to you from RSH 2025. Ahmed, thanks
yeah,
again.
thanks, Dr. Khalid. Yeah, thanks a lot.